Welcome to your Health Facts podcast, where we explore the subtle signals your body sends, especially at night.
Tonight, we're diving deep into the surprising connection between nighttime discomforts and potential blood sugar imbalances.
You might be surprised to learn how many seemingly unrelated sleep disturbances might be
Exactly.
linked to how your body handles sugar.
Yeah, let's start with frequent nighttime urination, also known as nocturia.
Okay.
This involves waking up multiple times throughout the night to use the bathroom, and it can significantly disrupt your sleep.
Right.
The reason this happens is that when your blood sugar is high, your body tries to flush out the excess sugar through urination. This leads to dehydration and can leave you feeling tired and groggy the next day.
Yeah, I can imagine.
One patient I saw was getting up 10 times a night.
Oh, wow.
Imagine the impact that had on their daily life.
Yeah.
But the good news is, with some simple adjustments, things can improve remarkably quickly.
Well, that's good.
And of course, that frequent urination leads to our next point. Excessive thirst.
Right.
High blood sugar causes dehydration, making you thirsty. You drink more, which leads to more urination.
Yeah.
It becomes a vicious cycle, further dehydrating you.
Right.
This constant need for water can disrupt your sleep and leave you feeling exhausted.
Makes sense.
It is important to understand that there's more at play than just sugar.
Okay.
High blood sugar often comes with increased sodium retention. When your body holds onto more sodium, it needs more water to maintain balance, which further contributes to that feeling of excessive thirst.
Now let's talk about restless leg syndrome.
Okay.
That irresistible urge to move your legs, especially at night.
Yeah.
This can be incredibly frustrating and significantly impact your sleep quality.
Right.
What many people don't realize is that this common ailment can be connected to a potential deficiency in vitamin B1, also known as thiamine.
This deficiency is often observed in individuals with consistently high sugar intake.
I see.
Here's why.
Okay.
When you consume a lot of sugar, your body needs more B1 to process it. Over time, this can lead to a deficiency. Without enough B1, lactic acid builds up in your muscles, preventing them from getting enough oxygen. This can lead to nighttime restlessness and that urge to move your legs.
Adding to that, magnesium deficiency also plays a role in restless leg syndrome.
Absolutely.
This deficiency is frequently observed in people with blood sugar regulation issues.
Right.
Without enough magnesium, your muscles can't properly relax, contributing to those uncomfortable leg sensations.
Yeah, like your body's trying to tell you something's not quite right.
Exactly.
Another condition that can be linked to blood sugar imbalances is peripheral neuropathy.
Okay.
This condition affects the nerves in your extremities, particularly your feet, causing a range of sensations like burning, pain, numbness, and tingling.
Wow.
These sensations often worsen at night due to increased blood pooling in your feet while you're lying down.
Imagine how frustrating that would be trying to fall asleep with those sensations keeping you awake.
I know, right?
And we all know how important a good night's sleep is for our overall health and well-being.
And then there are leg and foot cramps, those sudden, often painful muscle contractions that seem to strike at the worst possible time.
Oh, man.
These nighttime cramps are often linked to magnesium deficiency.
Okay.
Remember we talked about magnesium and its role in muscle relaxation?
Absolutely.
Yeah.
Magnesium helps your muscles relax while calcium is responsible for contraction.
When you don't have enough magnesium, calcium builds up inside your muscle cells, disrupting this delicate balance.
Right.
As a result, your muscles are more prone to contracting instead of relaxing, leading to those unwelcome cramps.
Now let's talk about excessive sweating at night.
Okay.
And I'm not talking about menopausal night sweats, but rather sudden, unexplained sweating that can leave your sheets feeling damp.
Right.
This is different from the hot flushes many women experience during menopause.
This type of sweating is often related to blood sugar imbalances that trigger your body's fight or flight response. When this happens, your body releases adrenaline, which can cause you to sweat profusely even if you're not physically exerting yourself.
It's like your body is constantly on high alert, even when you're trying to rest.
Exactly.
And this state of heightened stress can also contribute to sleep apnea, a condition where your breathing repeatedly stops and starts during sleep.
Sleep apnea is often linked to insulin resistance, a common issue in blood sugar imbalances. Insulin resistance occurs when your body's cells don't respond properly to insulin, the hormone responsible for regulating blood sugar levels.
This can lead to a buildup of glucose in your blood and a cascade of other health problems, including weight gain.
Right. You see, insulin is also a fat-storing hormone.
Interesting.
When your cells become resistant to insulin, they can't effectively absorb glucose from your bloodstream.
Mm.
This forces your body to store the excess glucose as fat, leading to weight gain.
Speaking of insulin, it's important to understand that high insulin levels can actually lead to nighttime drops in blood sugar known as hypoglycemia.
It might seem counterintuitive,
Yeah, how does that happen?
but here's how it works.
Okay.
When you have high insulin levels, it can overcompensate and pull too much sugar out of your bloodstream.
Ah, I see.
This causes your blood sugar to plummet, which can wake you up in the middle of the night with a jolt of adrenaline, leaving you feeling stressed and anxious.
Wow.
You might even wake up feeling shaky, sweaty, or confused.
And sometimes this isn't even caused by what you ate that day.
Right.
Your liver might be producing excess sugar even on a low-carb diet due to long-term dietary habits.
It's a reminder that our bodies have a long memory when it comes to what we eat.
It's amazing how our bodies work.
Now let's talk about delayed sleep onset.
Okay?
That frustrating inability to fall asleep even when you're tired.
Oh yeah, I know that feeling.
High blood sugar levels can interfere with the production of melatonin, the hormone that regulates your sleep-wake cycle.
When your melatonin production is disrupted, it becomes much harder to fall asleep and stay asleep, leading to those restless nights we all dread.
Moving on to another common nighttime gastric reflux, or GER.
Oh, GED, what is that exactly?
That burning sensation in your chest and throat often occurs when stomach acid flows back up into your esophagus.
And believe it or not, blood sugar can play a role here.
Blood sugar imbalances can affect your autonomic nervous system, which controls various bodily functions, including the valve that prevents stomach acid from backing up.
So even something as seemingly simple as heartburn could be a sign of a deeper issue with blood sugar.
Exactly.
It's amazing how interconnected everything is.
And this interconnectedness extends to our dreams as well.
Okay.
Nightmares and vivid dreams can sometimes be linked to a deficiency in vitamin B1.
Oh, right. We discussed that earlier in relation to restless leg syndrome.
High carb intake and diabetes can deplete your body of B1, and this deficiency can manifest in a variety of ways, including those disturbing dreams that wake you up in a cold sweat.
It's like your subconscious is trying to send you a message.
Now let's talk about a more serious nighttime symptom, high blood pressure at night, or what's known as non-dipping.
Non-dipping.
Normally, your blood pressure should drop at night as your body relaxes, but in some individuals with diabetes, their blood pressure doesn't follow this pattern.
So it stays high all night.
It remains elevated throughout the night, putting extra strain on their cardiovascular system.
That sounds serious.
This non-dipping pattern is a red flag that shouldn't be ignored, and it highlights the potential long-term consequences of uncontrolled blood sugar.
And speaking of red flags, another nighttime symptom to be aware of is heart palpitations. That feeling of your heart racing or pounding in your chest.
Nighttime palpitations can be attributed to electrolyte imbalances, particularly deficiencies in potassium and magnesium.
Interesting.
These minerals play a crucial role in regulating your heartbeat, and when you're deficient, it can lead to those unsettling heart flutters.
So what can people do about that?
A good electrolyte powder, rich in potassium and magnesium, can be helpful in addressing this issue.
Okay, good to know.
Next, we have teeth grinding, a surprisingly common nighttime habit that can be incredibly damaging to your teeth.
Oh yeah, teeth grinding can be a real problem.
Teeth grinding is often linked to stress and anxiety.
Right?
And as we've discussed, blood sugar imbalances can put your body in a constant state of fight or flight, leading to increased jaw muscle tension and teeth grinding.
So it's like your body is physically manifesting the stress caused by blood sugar dysregulation.
Exactly.
And finally, let's talk about morning headaches, a common complaint that can often be traced back to dehydration.
Remember how we discussed frequent urination and excessive thirst as early signs of blood sugar problems?
Yeah.
Well, that dehydration can carry over into the morning, leaving you with a pounding headache.
It's crucial to remember that proper hydration involves more than just drinking water.
Right.
You also need electrolytes to replenish the minerals lost through urination.
So those are just some of the nighttime signs that your blood sugar might be out of whack.
It's remarkable how many seemingly unrelated symptoms can actually be connected to this one underlying issue.
It's a testament to the intricate ways our bodies communicate with us.
By paying attention to these subtle signals, we can gain valuable insights into our overall health.
Absolutely.
We'll continue our deep dive into the fascinating connection between nighttime discomforts and blood sugar in part 2 of this episode.
But first, a quick reminder to subscribe to yourhealthfacts.com for more insights and resources on this and many other health topics.
All right, sounds good.
Welcome back to your Health Facts podcast. We're continuing our deep dive into the nighttime signs of blood sugar imbalances.
In this segment, we'll explore how seemingly unrelated nighttime discomforts can be linked to blood sugar. It's like our bodies are sending us coded messages, and it's up to us to decipher them.
Once we start paying attention to these messages, we can take steps to address the underlying issue and improve our overall health. This isn't about simply managing symptoms, it's about understanding the root cause and making sustainable lifestyle changes.
Knowledge is power. The more we understand about how our bodies work, the better equipped we are to take care of ourselves. Let's delve a bit deeper into some of the key concepts we've touched upon tonight, starting with insulin resistance, a condition that lies at the heart of many blood sugar imbalances.
Insulin is a hormone produced by your pancreas that helps regulate blood sugar levels when your body becomes resistant to insulin. Your cells don't respond to it properly, leading to a buildup of glucose in your bloodstream. This excess glucose can damage blood vessels, nerves, and organs. It's a major contributor to conditions like type 2 diabetes, heart disease, and stroke.
So what causes insulin resistance? It's a complex interplay of factors, including genetics, lifestyle, and diet. A diet high in processed foods, refined carbohydrates, and sugary drinks is a major culprit. These foods cause rapid spikes in blood sugar levels, putting a strain on your pancreas and eventually leading to insulin resistance.
Physical inactivity also plays a significant role when you're sedentary. Your muscles don't use glucose as efficiently, further contributing to insulin resistance. The good news is that insulin resistance can often be reversed or at least improved with lifestyle changes.
Adopting a healthy diet, rich in whole foods, fiber, and lean protein, can make a significant difference. Regular exercise is equally important. It helps your muscles become more sensitive to insulin, improving glucose uptake and lowering blood sugar levels.
Managing stress is crucial as well. Chronic stress can elevate cortisol levels, which can interfere with insulin signaling. It's not just about what you eat and how much you move, but also about how you manage stress and prioritize mental well-being. We can't overlook the role of the gut microbiome in blood sugar regulation. The trillions of bacteria that reside in our guts play a crucial role in digesting food, absorbing nutrients, and regulating various bodily functions, including blood sugar control.
Research suggests that an imbalance in the gut microbiome, known as dysbiosis, can contribute to insulin resistance and other metabolic disorders. This imbalance can be caused by factors like poor diet, antibiotic use, and chronic stress.
It's fascinating how the gut microbiome can influence our health in so many ways. It's like a hidden ecosystem within our bodies, and just like any ecosystem, it needs to be balanced and diverse to function optimally.
So how can we promote a healthy gut microbiome? Diet is key. A diet rich in prebiotic fiber, which feeds the beneficial bacteria in our guts, is essential.
Foods like fruits, vegetables, whole grains, and legumes are excellent sources of prebiotic fiber. Probiotic foods like yogurt, kefir, and sauerkraut can also be beneficial as they introduce live beneficial bacteria into the gut.
Fermented foods like kimchi and kombucha are rich in both prebiotics and probiotics. These fermented foods can help diversify the gut microbiome, promoting a healthy balance of bacteria. Taking care of our gut health is an important part of maintaining healthy blood sugar levels.
Our diet, lifestyle, and even our thoughts and emotions can impact our gut microbiome, which in turn can influence our blood sugar regulation. It's a reminder that our bodies are complex and interconnected systems, and everything is linked in some way. Now, let's shift gears and talk about some specific nighttime symptoms in a bit more detail, starting with sleep apnea, a condition that affects millions of people worldwide.
Sleep apnea is characterized by repeated pauses in breathing during sleep. These pauses can last anywhere from a few seconds to several minutes and can occur hundreds of times throughout the night. There are two main types of sleep apnea: obstructive sleep apnea and central sleep apnea.
Obstructive sleep apnea, the more common type, occurs when the muscles in the back of your throat relax and block your airway. Central sleep apnea, on the other hand, occurs when your brain fails to send proper signals to the muscles that control breathing.
Sleep apnea can have serious consequences if left untreated, increasing the risk of high blood pressure, heart disease, stroke, and other health problems. There's a strong link between sleep apnea and insulin resistance.
Insulin resistance can contribute to weight gain, particularly around the abdomen and neck. This excess weight can put pressure on the airway, increasing the risk of obstructive sleep apnea. Additionally, insulin resistance can disrupt the balance of hormones involved in sleep regulation, further contributing to sleep apnea. It's a vicious cycle. Sleep apnea can worsen insulin resistance, and insulin resistance can worsen sleep apnea.
The good news is that there are effective treatments for sleep apnea, including lifestyle modifications like weight loss and avoiding alcohol and sedatives before bed. Continuous positive airway pressure, or CPAP therapy, is also a common treatment. It involves wearing a mask that delivers pressurized air to keep your airway open during sleep. In some cases, surgery may be necessary to remove excess tissue or correct structural abnormalities in the airway.
Now let's move on to another common nighttime symptom, restless leg syndrome, or RLS.
RLS is a neurological disorder that causes an irresistible urge to move your legs. This urge is often accompanied by uncomfortable sensations like crawling, tingling, or aching. These sensations typically worsen at night and can make it difficult to fall asleep and stay asleep.
RLS can be linked to iron deficiency in certain medications, but it's also important to rule out other potential causes like peripheral neuropathy, kidney disease, and pregnancy. Treatment for RLS often involves addressing any underlying medical conditions and making lifestyle changes like regular exercise, and avoiding caffeine and alcohol medications can also be helpful in managing symptoms, and in some cases, iron supplements may be recommended.
Now let's talk about nighttime sweating, a symptom that can be caused by a variety of factors, including menopause anxiety and certain medications.
Nighttime sweating can also be a sign of blood sugar imbalances, particularly hypoglycemia. When your blood sugar drops too low, your body releases adrenaline, which can trigger sweating. This is why people with diabetes often experience nighttime sweats if their blood sugar isn't well controlled. If you're experiencing nighttime sweats, it's important to talk to your doctor to rule out any underlying medical conditions.
Now let's move on to another common nighttime symptom, heart palpitations.
Heart palpitations are a feeling of your heart racing or pounding in your chest. They can be caused by a variety of factors, including stress, anxiety, caffeine, and certain medications. But heart palpitations can also be a sign of electrolyte imbalances, particularly potassium and magnesium deficiency. Electrolytes are minerals that play a crucial role in regulating your heartbeat, and when you're deficient, it can lead to those unsettling heart flutters. A good electrolyte powder rich in potassium and magnesium can be helpful in addressing this issue.
Welcome back to your Health Facts podcast. We're wrapping up our deep dive into the nighttime signs of blood sugar imbalances. Now, let's talk about nighttime GERD, or gastroesophageal reflux disease.
GERD is a condition that occurs when stomach acid flows back up into the esophagus, causing heartburn and other uncomfortable symptoms. Blood sugar imbalances can contribute to nighttime GERD.
Interesting.
Blood sugar imbalances can affect the autonomic nervous system, which controls various bodily functions, including the valve that prevents stomach acid from backing up if you're experiencing nighttime GERD. It's important to talk to your doctor to rule out any underlying medical conditions and discuss treatment options.
Okay. And are there things people can do on their own to help?
Yeah, lifestyle changes like avoiding large meals before bed and elevating your head while sleeping can also be helpful.
Now let's move on to another common nighttime symptom. Vivid dreams and nightmares. Those can be pretty unsettling.
Vivid dreams and nightmares can be caused by a variety of factors, including stress, anxiety, certain medications, and sleep disorders. They can also be linked to vitamin B1 deficiency, which can be associated with high carb intake and diabetes.
Oh, right. We talked about that earlier.
Yeah, if you're experiencing frequent vivid dreams or nightmares, it's important to talk to your doctor to rule out any underlying medical conditions and to discuss treatment options.
Now let's talk about teeth grinding, also known as bruxism. I know a lot of people who do this without even realizing it.
Teeth grinding is often linked to stress and anxiety, and as we've discussed, blood sugar imbalances can put your body in a constant state of fight or flight, leading to increased jaw muscle tension and teeth grinding.
It's like your jaw is trying to release all that pent-up stress.
Exactly. If you're grinding your teeth at night, it's important to talk to your dentist to discuss treatment options like a mouth guard.
And finally, let's talk about morning headaches. Those can really ruin your day.
Morning headaches can be caused by a variety of factors, including dehydration, sleep apnea, and caffeine withdrawal. They can also be linked to dehydration caused by frequent urination associated with blood sugar imbalances. If you're experiencing frequent morning headaches, it's important to talk to your doctor to rule out any underlying medical conditions.
As we conclude our deep dive into the nighttime signs of blood sugar imbalances, I want to emphasize that knowledge is empowering. The more we understand about how our bodies work, and the subtle signals they send, the better equipped we are to take charge of our health.
Remember, these nighttime symptoms are not meant to scare you. They're simply your body's way of communicating that something might be off. It's like a check engine light in your car. It's a signal to investigate further, not to panic if you're experiencing any of the symptoms we've discussed tonight. It's important to consult with a healthcare professional for personalized advice. They can help you determine the root cause of your symptoms and develop a plan to address it.
And remember, lifestyle changes play a crucial role in managing blood sugar levels.
Yeah.
A balanced diet, regular exercise, stress management, and quality sleep are all essential. It's about creating a holistic approach to health that addresses both the physical and mental aspects.
Absolutely. It's a journey, not a destination. Be patient with yourself and celebrate small victories along the way.
And don't forget, you're not alone. Millions of people struggle with blood sugar imbalances. There are resources available to support you.
For more information on this topic and many others, visit yourhealthfacts.com and subscribe for updates.
Thank you for joining us on this deep dive into the fascinating world of our bodies. Sweet dreams, everyone, and until next time, stay curious about your health